And we'll turn now to Andrew Woodcock from The Independent.
Mr. Gove, there are large numbers of people all around the UK who are reliant on food distribution through food banks and other charitable efforts. These charities are still working, but many food banks have closed and donations are down. Many volunteers are over 70 and they've been advised to stay home. The Independent's launching a Help the Hungry appeal to support the London Food Alliance, but there's need right across the country. The government says it's supporting all sections of society through this crisis. So is there going to be financial and logistical support for these charities? Are any of the 700,000 people who volunteered to help the NHS being committed to this effort? And Sir Simon Stevens, could I ask, you've been head of the NHS since 2013. Do you regret the bed reductions and the failure to increase nurse training numbers during your tenure, which have left the NHS in a position where it entered this crisis with its critical care bed base amongst the worst in Europe, with Italy, for example, having twice as many ICU beds, and the UK having the lowest number of nurses and doctors per head amongst developed nations, according to the OECD? Isn't the lesson from this crisis that the NHS needs more capacity at all times if it's going to be ready to deal with this kind of surge in demand, and it can't be made to operate with no slack as it has been under your watch?
Andrew, thank you for those questions. On food and helping the vulnerable, let me say a few things. The first thing is I want to thank all those who work in food production and in our supermarkets for rising to the challenge of making sure that our shelves can be refilled and that people who need it are able to get the food that they need. Now, of course, we need more than simply to have an effective food production chain. We need to make sure that those most in need, those who are self-isolating, get the food and the other support that they need. That's why the NHS has identified up to 1.5 million people who are shielded, who've been advised to self-isolate for 12 weeks. And it's why government departments working together are ensuring that there will be food distributed direct to those individuals, with community pharmacies also providing the prescription medicines that they need. Now, there are people beyond that 1.5 million who are not self-isolating for 12 weeks, but who are vulnerable, people who in the past have used food banks, people whom we need to support now. And it is the case that the volunteer networks that have been set up across the country are ensuring that we can match volunteers who are willing to go shopping and to hand food to those vulnerable people who are staying at home or who may not themselves have the social networks to get the food that they need. And of course, the tremendous response to the Good Sam initiative that Matt Hancock announced earlier this week, with hundreds of thousands of people stepping up, is an amazing example of voluntarism in action and national solidarity. And we will be doing everything we can to support them. And my colleague Oliver Dowden at the Department of Culture, Media and Sport is looking at a specific fund in order to support charities in the work that they do. And we'll be saying more about this in the days to come. I also want to thank those people in the hospitality and catering sector who have stepped up and who are doing everything they can to support the vulnerable. John Vincent of Lyon is making sure that his stores remain open as takeaways in order to support the NHS. It's that sort of collaboration between citizens, the voluntary sector, backing from government and enlightened business people that I think will help us to beat this virus. And I'm grateful to you for the opportunity to thank all those who are making that contribution. I'll now hand over to Simon.
Thank you. So the NHS does need more staff and it does need more hospital beds, and we've been saying that for some time, and that is what's going to be happening over the next 5 and the next 10 years. But the reality is that what I've described is that over the last several weeks, we have freed up the equivalent of 50 hospitals across England ready and waiting for coronavirus patients. Under normal circumstances, you would not keep 50 hospitals fully staffed with nurses and doctors not actually looking after patients, which is why no health service in the world, anywhere in Europe, anywhere internationally, would be able to withstand a coronavirus epidemic unless the sort of measures that the public are also involved with are also put into place. And that's why it's so important that the public support the work of our very pressurised frontline nurses, doctors, therapists and other staff across the NHS by staying at home and in so doing saving lives.
Thank you. And we'll turn now to